we're going to go over the discharge sheet that you get when you pick your dog up following TPLO surgery. Welcome to Canine Wellness Online. I'm Tania Costa, a certified canine rehab practitioner. So today I'm going to show you a few of the top things that you will see on your discharge sheet and how to do it. Most people that are bringing their dog home are very afraid to touch where the surgery site is. So what I want to show you today is when it says on your sheet, monitor the incision daily for signs of infection. So basically what that looks like. So you may have an e-collar on your dog. You may have a lick sleeve on. Obviously, you're going to have to take that off. Basically, what you do is the surgery site, most likely, always is on the inside. And what you're going to do is just gently lift up the leg. Hopefully you're a little bit more flexible than I am, and look underneath and just touch it a little, very, very lightly on the other side, of course, lightly touch it and just see what it feels like. It's really a good idea to touch it every day so that you have a sense of when it's hot or when it's not hot, because being hot is a sign of infection. So again, you're going to lift the leg up and just look at it and just touch it lightly. So part of the medication regime is they talk about, let us know, as it says here, if your dog has an adverse reaction to the medications. And a lot of dogs, because a lot of veterinarians prescribe Medicam, and a lot of dogs have GI upsets from that. So what you're looking for is, does your dog not want to eat? Is your dog vomiting? Or does your dog have dark tarry stool? Or perhaps diarrhea, which is the most common thing with Medicam. And these are adverse reactions to that medication. So if this is occurring, don't stop the medication. Phone your veterinarian and say, my dog is having a reaction, because there are many more different types of anti-inflammatories that may not affect your dog in the same way. And the last thing is, very often they will say, do massage. What massage looks like in the first few days when you come home is not this whole thing here, is really lightly touching the leg and bringing your hand up. And what you're trying to do is move fluid up towards the body so it can dissipate throughout the body. You don't want to go downwards, because then you're pushing fluid down towards the extremity, and you can actually get something called a seroma developing down, lower down. So all you're going to do is go against your dog's fur and just lightly touch and move your hand with the palm, this part of your hand, upwards, and just very lightly. And as a side note here, if your dog keeps moving away, don't force it. If he doesn't like it, don't do it. And the last thing, of course, is ice and heat. And I also have a video on that. But the Reader's Digest version of that video is, you want to ice this part of the leg. So the surgery is right about here. So what you want to do is take an ice pack, wrap some paper towel around it, and you can place it right over this area or across and around this area. And that's only for the first 48 hours. And after that, you can move into moist heat. So I hope that helps, and stay tuned for the next video.